the appreciation level for all that they've given us is also never forgotten. So, nevertheless, I've got to say one more thing. Last night, I was with a group of people, in Clarksburg at one of their dinners and everything, and it was the county clerks from all across our state and all those people from all the way up to our Secretary of State and all those that handled our elections. And, it's amazing if you just step back and just think of what they did. I mean, we had a primary right in the thrust of all this controversy and everything wheeling around. Should you have an election? Should you postpone the election? Should you do it all by absentee ballot? Everything under the sun. They pulled it off. They turned right around and pulled off a general election, and I think it was either first or second in the nation. In a record in our state as far as a record turnout of voters. 800,000 voters in West Virginia. And they pulled it off absolutely miraculously, and they teased me a bunch last night and everything. I had a guy that impersonates me and everything. He was great, and he was really, really funny and everything. And I'm glad I brought a bunch of humor to everybody. And I'm glad to see a guy, honest to goodness, that is bigger than me. And that, that made me feel good. But it was a good night, and great bunch of people, and I just love being with them. But nevertheless, from the standpoint of our numbers, we have 189 people that are 189 new positive cases. Our positivity rate was at 6.17, probably because we didn't test an awful lot, but our cumulative rate stayed at 4.94. Here's the trouble. We have 1,656 active cases in West Virginia, and that is significantly up. We dropped below active cases below 1,000. Now we're at 1,656. Not good, not good. Our recovered cases are still at 161,705, and that's just because of lack of update. We're back above 100 people that are hospitalized. We're 111 people hospitalized and 47 of them in the ICU unit. We have no red counties. We have 1 orange county, 12 yellow counties, and 7 gold. It doesn't take a rocket scientist to figure this out. It doesn't. Look at that. Put that map back up. Just look at the map. Just think. The Delta virus that we see on the national news, or the Delta variant that we see on the national news, and we're wondering if it's coming. We're wondering if things are going to get worse and come. Look at the map. Where do almost every one of those counties touch? They touch the surrounding state. That tells us everything. We've got to keep our guard up. We don't need to panic, but we've got to keep our guard up here. If you're 65 years of age and older, and absolutely you have any symptom at all, you've got to get tested. It doesn't take a second to get tested. And not only that, if you happen to be positive, we've got the drugs, the antibodies, and everything that can shut this thing down. And if you don't, and you end up with this thing, and especially if you end up with this Delta variant, it could be tough. A perfect example of what I'm trying to tell you, I want to always try to practice what I preach. About, a week ago, I got this cold and cough a little bit, and I didn't feel the greatest and everything. Maybe it was 10 days ago now. And so I thought, sure better get tested. So I did. Came back negative and everything. Didn't feel like that there was any danger, but I thought, if I'm going to tell people to do this, I surely need to be doing it. And then this thing's kind of hung on. And, and since it's just kind of hung on and everything, I got tested again. Came back negative again. But that's what I'm telling you. If you're 65 and plus, come on. We don't need to be reading your name here. We do not need to do that. We have free testing, absolutely free testing. Please take advantage of it. The eligibility is 12 and older. Second shots is really important. The effectiveness of the vaccine is terrific. Young people are still lagging behind. We need absolutely to get you vaccinated. School is coming. We don't want interruptions in our school year. We don't want interruptions in our sports calendars. We don't want all the stuff that we've already been through. My dad said over and over and over, son, it's okay to be running a bulldozer and trying to be productive and everything and happen to be in a wet area and get the bulldozer hung up. But son, it's not okay to go get another bulldozer to pull that one out and get them both hung up. You know, and really and truly, we know what we've been through. Young people, you have the opportunity to be vaccinated, get vaccinated. And parents and grandparents encourage the young to get vaccinated. We need them vaccinated so badly. From the standpoint of the COVID information, it's all up there. You know, I'm sure Dr. Marsh will tell us more about the Delta variant. We're up to 43 cases now. I think we were at 32, is that right? We were at 32, you know, the last time we were here, I think that's correct. You know, but if we were at 32 on last Thursday, you know, and at that point in time, we had jumped from maybe 22 to 32. I can't recall exactly what the numbers were, but nevertheless, if we were at 32, we jumped 50% again. And, you know, and so, and I want to make sure that's right. No, well, it's more like probably 35% or something like that. We're at 35, I think. We jumped from 35 to 43, yeah. Okay, well, we've jumped a significant percentage, whether it be 25% or 30%, it's a significant percentage. It doesn't sound like much, but it is a significant percentage. Delta variant is now detected in 19 of our counties. There's some good news about the Delta variant that came out that I saw day before yesterday morning, and it was this, that in Europe, the Delta variant they felt like was on the tail end. And so there is some hope that the Delta variant in the United States is maybe, possibly, you know, winding down some. Well, if that be the case, unbelievable, great news, great news. And so, but all I would say is right now, no cause for super alarm by any stretch of the imagination, no cause, in my opinion, to start thinking we're going to run back and put our mask on or we're going to close this down or whatever and that down. No cause to be doing that at all, not any at all, but there's good cause to absolutely be concerned and don't drop your guard. In our Do It for Baby Dog sweepstakes and everything, we're going to be doing it again, I guess, tomorrow and then one more time, you know, all the prizes and all the stuff like that. You know, people are kind of onto this, but if you see me show up with Baby Dog, probably going to be a big day for you. Okay, you know, the vaccine distribution, we're up to 1,055,496 people that have gotten at least one shot. We're at 89.2% of the 65-year-olds and older that have gotten at least one shot. We're trying to get to 90. We'll get to 90, but that is an unbelievable number. 90% of the 65-year-olds have gotten at least one shot. And absolutely, we've got to make sure that they all get their second shots, you know, unless it's Johnson & Johnson. From the standpoint of our 50-year-olds, we're at 82.1%. It's amazing. It's great work, great work. We're at 67.8% of all those that are 12 and older that are eligible. That's really great too. Let's just keep it up. Let's just keep it going north. You know, as far as your testing opportunities, your pre-testing map, and all the great work that Fruth and Walgreens did for us is great, and we appreciate it, and take advantage, please. We're down to 2 outbreaks in our long-term care facilities, but our churches have jumped up to 7. We have 6 counties now, Cabell, Jackson, Jefferson, Marion, McDowell, and Putnam counties that all have an outbreak in the church community. We've got to watch that. We have 1 inmate case and 3 staff cases in our corrections. It's really great. You know, I remind you again about giving blood and how important that is and everything, and especially if you've had this dreaded disease and gotten over it. I think you absolutely have an obligation to think about it, to at least think about it. You know, from the standpoint of a sales tax holiday, you know, I heard a number the other day that was unbelievable, that the cost per student on going back to school, the supplies and whether it be book bags or clothes or whatever, the cost per student, you know, of kids going back to school was a big number, big number. It's a big burden on our families. So we're going to have a sales tax holiday that's going to be from July the 30th through midnight, August the 2nd, you know, at which, you know, we're going to exempt the sales tax, you know, on our folks that are buying supplies for kids going back to school. And so you know, at least we're trying to reach out and help a little bit. And that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. As the governor said, we continue to follow the Delta variant of COVID-19. And as a reminder, that's the variant that originated in India. Yesterday, we saw in the United States over 88,000 new cases, which is a continued increase over what we had seen before. And during the month of July, the number of new cases has quadrupled in the United States. When we look at the states that are the most severely affected by this new variant, we see that about 1 in 4 cases in the country comes from the state of Florida. And in many places in Florida, they are seeing surges in their hospitalizations of people more than they've seen at any other time during the pandemic, and particularly more than they've seen during this calendar year. So ultimately, we know that the Delta variant is in the United States, is responsible for the overwhelming majority of new cases. The governor reported that we have seen our documented number of cases from the Delta variant go up. And we know that although we have found more cases than we did before, that the true reflection of the number of cases is probably underrepresented, because we also know that the Delta variant can infect people who don't feel very sick and can spread very quickly. As a real quick reminder, the Delta variant has been found to be in much, much higher concentrations in the airways of people that are infected. A study from China demonstrated that there was about 1,260 times more virus in the airways with the Delta variant than were found with the initial COVID-19 strain that we saw from China. And therefore, the variant can spread very much more easily, presumably because it's packaged in a much more concentrated manner. The governor is also correct when he reports that in the United Kingdom, which has been one of the 2 places, I think, in the world that's been very aggressive and very successful with their vaccine delivery status, that they have started to see the number of new cases come down. And that gives us room for optimism. It is important to note that in most parts of the United Kingdom, they have over 70% of their population having at least 1 shot. 2 other pieces of information I think are interesting is there's been a new study that's looked at the timing, optimal timing between first and second shots. And at least in the study, they found that about 8 weeks was the optimal to get the best and maximal benefit from first dose to second dose. Now, obviously, we have been very, very consistent in saying that we really need to get people to choose vaccination, because we know still that 97% or so of people hospitalized in the United States today, and 99.5% of people who are dying in the United States today from COVID-19 are people that are not vaccinated. So it is really important to get the vaccines on the right schedule. But also, we want to make sure that even if you are going to have trouble getting both vaccines done immediately because you haven't started yet, even a single vaccine is better than no vaccines. And as the governor said, we are very much hoping that people do choose vaccination as important. The other thing that I think is really important to say is that the CDC is now reconsidering recommending masking for people even if fully vaccinated in certain parts of the country, particularly parts with really high amounts of virus. And there's also a very critical look that's being done now that the CDC is following with the vaccine manufacturers to look at the amount of antibodies that are present at about 6 months or so after the initial vaccination, and the determination when it might be wise to either consider another vaccination, which the country of Israel is considering right now, or an augmented next vaccine that will have more activity against variants like the Delta variant. So thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd just like to highlight some data to reinforce a point I want to make at the end. So we're in day 501 of the response to this pandemic. If we just look at the most recent month, the month of June, 91% of the people in West Virginia who were hospitalized had not had their full vaccination or had no vaccination at all. 88% of the deaths in West Virginia, people who had not been vaccinated. Across the United States, that number actually goes up to 99% and 97% hospitalization rate for those who haven't been vaccinated. While we also know now, as the governor pointed out earlier, our hospital numbers are shooting up. They are going up at a fairly reasonable clip right now. And while all that goes on, our trend line for vaccinations is still good, but only because, as the governor pointed out, it is bolstered by the great work of West Virginians over age 50 and particularly over age 65. In the younger categories, 12 to 17, if we look at full vaccination, it is only 29% of West Virginia children, 12 to 17, who are fully vaccinated. Ages 18 to 29, it's only 36% of West Virginians, and not much better for 30 to 39 and 40 to 49. So I know most people are familiar with me for over the 40 years of military service, and particularly the last 15 in key leadership roles in the National Guard responding to state emergencies. I think I'm someone that West Virginians trust, particularly in an emergency and a response. I am trying to reinforce to all of you, if you are still hesitant and you need some support from a medical professional, reach out to a medical professional and understand the value and the importance of the vaccine. Please quit following the misinformation that's out there, particularly across the internet and social media sites. Talk to someone who is a medical professional. Consider getting your children vaccinated and consider getting vaccinated. We need this to get past this. We don't want to be at day 601 or day 701 of this response. Thank you.
Thank you, sir. Dr. Ayn Amjad, our state health officer, is also joining us today and is available for questions. Secretary Bill Crouch with the DHHR had a prior engagement today, and he will rejoin us later. We will now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, Dr. Marsh just mentioned this, but later this afternoon at 3 o'clock, the CDC is expected to backpedal its mask recommendations, saying that even vaccinated people should probably resume wearing masks indoors. How will the state respond to that? Are there any plans to update the state's guidance to reissue some sort of mandate? Thank you.
Charles, like I said a bunch of times before, I do not think that we're on the threshold of moving in that direction today. We've all got to be smart enough to be open-minded and know that as we continue to watch and we continue to listen to all the experts, we're going to have to absolutely always be open-minded as to what to do. You know, Charles, right today, I have not had a recommendation whatsoever from any of the medical team and everything, but I will continue to listen, and I will absolutely act on, you know, the advice of experts and everything, but I'll also have my opinions as to what we should do. You know, I hope and pray that we do not slip back into the situation to where we have to revisit and we have to move in a positive way as far as masks or whatever it may be. We've been through enough. We've been through enough. And I absolutely want to just take 1 second to reinforce just this. You know, General Hoyer, you know, General Jim Hoyer, absolutely an American hero in so many ways. And what a job he's done over and over. You know, I have been to battle with him, and I have been out in the mud with him and everything, and the terrible times of floods and whatever it may be. I have seen all the work that he's done in regard to COVID. He's sitting with you and saying, as a soldier, as an American hero, absolutely how important it is for our young people to step up like our elderly people have already done. I would just follow up right with this exact statement and just say just this. Do we really want to deny what is happening, whether it be Dr. Marsh is speaking or the great General Jim Hoyer that is speaking to you? Do we want to just turn our backs on that? Do we really want to take the chance of going back to school the way we went to school the last year? Do we want to take the chance with counties saying, no, we've got to go virtual? Do we want to take the chance of having to wear masks all over the schools? Do we want to take the chance in teams after teams after teams that are infected and can't play and this and that, or fans, mom and dads or grandmas can't come and see their kids play? Do we really want to do that again? And we can avoid every bit of that if you'll just do what that good general was asking you to do. Step up. 29%. Are you kidding me? 29% of our 12 to 17-year-olds are not, that's all we have vaccinated. What in the world? I mean, really? 29%, that's it? You know, and 36% of our 18 to 39-year-olds? We got to get people vaccinated. You know, I can sit here, General Hoyer can sit here, Clay Marsh can sit here, Dr. Marsh, Dr. Amjad, you know, Secretary Crouch, all the people that you want to parade in. I don't care how many you parade in. We can all sit here saying the same thing, speaking with the same voice. It's not a political voice. There is not one fiber of political in me. I don't want it in me. But as we speak to you and we plead with you to go get vaccinated, you know, we could be sitting here and say, okay, well, if you don't want to do it, just don't do it. Don't call me. Don't call me when the wheels fly off. You got to get vaccinated. Anyway, Charles, thank you.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Well, let me follow up on Charles' questions because we're getting some specifics on this now. According to CNN, what the CDC is going to recommend at 3 o'clock this afternoon is that all K through 12 students wear a mask to school and at activities, whether they are vaccinated or not. So again, that's the recommendation we'll hear from the CDC today, that K through 12, everyone should be in a mask, whether vaccinated or not. I'd like to get, Governor, given that information, your reaction as well as the reaction from the doctors from a medical standpoint. And this is, again, a recommendation. It's not a requirement. And I'm wondering if West Virginia is going to comply with the federal recommendations.
Mark, you know, what we'll do once we see it and everything, we'll absolutely review and we'll go over it with all the experts over and over and over. I am extremely hopeful that we absolutely, and I don't think we're there at all at this point in time, but Mark, we knew it was coming, didn't we? I mean, really and truly, those kids, we don't have the vaccines approved for those kids to get vaccinated. And really, we do know that some of those kids very tragically are getting this terrible disease. And we do know that schools, we're going to be going back to school and we're going to all be in a building and all be closer together and everything. We knew it was coming, didn't we, Mark? We can stop it. We can stop it. But really and truly, our hesitancy or stubbornness or whatever you want to call it is really slowing down to stopping it. But again, I've said it over and over, and I hope to goodness that someone that's just decided, well, I'm not going to take the vaccine no matter what. I'm not being critical of them in any way. All I'm just saying is just this, that all the science and everything tells us to get vaccinated. Absolutely, without any question, your hesitancy to not get vaccinated is not only just affecting you, it affects others. Now, I am completely respectful of all your rights and you, absolutely. I am just telling you that in this situation, folks that aren't vaccinated, we have an opportunity to stop it. And so, Mark, we'll look at it and we'll surely listen. I felt sure that it was coming. And if we don't curb this thing and start really moving toward getting more and more of our folks vaccinated, I would say the recommendations are going to get even more severe. And so of every living, breathing human being, I can tell you that Jim Justice surely doesn't want this. Surely doesn't want this stuff. Because, man, it's been tough enough. That's all there is to it for lots of folks. Anyway, I'm done. Go ahead.
All right, thank you, Governor, and thank you, Mark. Next, we'll go to Bob Arum with WCHS and Fox 11.
I was wondering how important it is for people to get the second shot and how we're doing. It seems like we were doing better than other parts of the country in getting the people to get the second shot. But just looking at the numbers roughly, it looks like about 10% of the folks aren't coming back for the second shot. How significant is that and in those numbers?
Maybe Dr. Amjad, or Clay, you guys talk, please.
Sure, Governor. Paul, I mean, you have to get the second shot or it's not as effective. So we do know that, you cited 10% are not coming back. So we do try to reach out to those people, but you have to have the second shot for the vaccine to be effective. So we do want people to come back, and we do encourage people to come back and get the second shot.
All right, thank you, Bob. Next to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. Interesting questions so far. California and New York City are requiring their government employees to be vaccinated or submit the weekly testing. Is there any talk of requiring the same thing for West Virginia's more than 36,000 full-time employees or the 37,000 public school teachers, administrators, and school service personnel? Thank you.
Stephen, the best way that I can answer that is surely not at this time, and hopefully never. But Stephen, it would be frivolous for me to tell you that, to speak in terms that are absolute, and say never, never, never on this or whatever it may be. Stephen, this thing changes daily or weekly like crazy, and we've got to be in a position to be able to pivot, because the one thing that we have done, we've adjusted, and praise God above, we have adjusted in the right way all through the pandemic, all through the whole way. Maybe it's not been perfect, but it's surely been the right way. Now, the one thing, and I want to say this, and I want everyone to hear me on this. There is an indicator here that will really, really move the needle as far as people getting vaccinated. The indicator is really simple. If people start dying like flies out here, and we start seeing body bag after body bag, you can bet your boots that people will absolutely run to get vaccinated. Do we want it to come to that? Do we really have to come to that tragedy to get people to really move? Stephen, right now there's no plans to make anything mandatory about people, being vaccinated. But I want to tell everybody in the world that I will be the governor, and really and truly, I will act. I'll do the very best for the people of West Virginia that I can possibly do with all the guidance from our medical experts. But I will do my job, and everyone's got to know that this situation is absolutely fluid. It has been that way since the beginning. We could shut it down, but if we choose not to shut it down, then we've got to absolutely continue to deal with it and be fluid and make the best decisions that we can possibly make.
All right, thanks, Steve. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, I want to know if, even though that you've lifted the mask mandate, if you still carry a mask around, if you have felt the need to wear it since you've lifted the mandate, and if not, under what situations you would, and maybe even have the medical people weigh in on that. Should we carry masks around for certain situations? Thank you.
Paul, I've got masks with me all the time in my vehicle. There's from time to time that I've been in hospitals that absolutely you have to have a mask on. I was in a hospital last week at WVU and at Ruby, and surely had my mask on. I guess it was probably a couple of weeks before that. Our grandson was sick, and at Ruby, and we had our mask on there as well. But Paul, I don't think there's any point in people carrying their mask in their back pocket and everything. But we'll have guidance from this office and everything with our experts and everything as to what to do. But gosh, I wish we could have had a mask burning and never see those masks again and everything. But at the same time, Paul, we all know that this thing's tough stuff, and nobody's got a playbook, and we're not there now. But we're gonna stand guard and watch the shop. That's for sure.
All right, thanks, Paul. Next to Jasmine Aduse with WDTV.
Hey, thanks. Good afternoon, everyone. Jasmine Aduse from WDTV News in Bridgeport. Just a question for Dr. Claymarsh there. Just want to know the importance of healthcare workers, being vaccinated with the COVID vaccine, and any sort of prediction for any more mandates. Just would like Dr. Claymarsh's thoughts on that. Thank you.
Dr. Marsh, please.
Well, thank you, Jasmine. Thank you, Governor. So we know, Jasmine, that one of the critical factors in any potential enhanced or increased number of people hospitalized is to have the medical staff available to be able to tend to those people. And as the governor has said many times, as General Hoyer said today, and as I have said, that the most important protection that we have is to be fully vaccinated. And we know that the more our population is fully vaccinated, the more we are protected against not only manifestations of the Delta variant from COVID-19, but all of the other impact of this virus. It's interesting that the American Disabilities Act just got amended today to include people with long COVID, with symptoms that are persistent for the long term to be included in that, which shows you the great long-term impact of this disease. I think when it comes to other recommendations, as we have heard today, more and more people are recognizing that this Delta variant is different. It's not the same COVID-19 we dealt with last year. It is much more capable of infecting people. It has much more concentration of virus in each droplet. And remember, the way that we become infected is we breathe in droplets or aerosols from people who are infected, and the amount of virus in those droplets and aerosols goes up. So I think that the other mandates or other recommendations we would make, instead of waiting until you have the CDC or the governor's office or any other oversight entity sort of dictate what needs to be done across large populations, each person should take personal responsibility and not only choose vaccination, but also be cautious. And if you're indoor environments where there's a lot of people and you don't know them, and you're elderly, or you have a chronic health problem, or you are immunosuppressed, you've had a transplant, you're taking medicines, you are getting chemotherapy for a cancer, then protect yourself. Avoid those places, wear a mask. Even if you're fully vaccinated, those additional layers of protection never hurt. And so I think that we want to empower each person to make sure you're taking care of yourself and your family. But most importantly, do that by choosing to be fully vaccinated. Thank you.
All right, thank you, Jasmine. Next to Marley Pinchok with WSAZ.
Good morning, Governor. I have a couple of questions related to the vaccines. So we've noticed the state is at a plateau when it comes to vaccinations. At the same time, COVID hospitalizations have increased pretty significantly. So of the state's current COVID cases and hospitalizations, can you tell me how many are unvaccinated persons? I'm asking you because yesterday the DHHR told us that they do not track this information. So does anyone in the state track it? Right now, 111 people are in the hospital with COVID. So if that data showed all of those people were unvaccinated, wouldn't that critical information urge people to get the vaccine?
It's a great point. Great point. And Dr. Amjad, maybe you can elaborate on this some, but I was having a little trouble hearing, but I think it's a great point. And to be perfectly honest, I think that we should try within us, if we can, with the HIPAA laws and all that kind of stuff, if we can, to tell people these numbers. Tell people how many people are not vaccinated. Tell people the numbers of folks that are in the hospital or hospitalized and everything that are unvaccinated. If we can do it, Dr. Amjad, maybe you can add something to that. But a great question. I loved it, and it would be a motivator.
Yes, Governor. Well, Molly, we have some numbers that I can give you, but I don't have all the numbers for the vaccinated in the hospital. But that is something that we're trying to work on. It is very difficult to track all the cases in the hospital with the vaccines, who's been vaccinated and who hasn't, but that is something we're working on because we would like to include that on our dashboard. But some numbers that I can give you with the Delta cases, because we are tracking those because those are of interest and we are trying to track those right now. But some numbers I can give you for that. So we have 43 Delta cases in the state right now. Of those, 10 cases are vaccinated and they were in the hospital, but of those 10 cases, those patients were what we consider severely immunocompromised, but they were vaccinated individuals. Of those 43, 23 of those were not vaccinated. So you can see how 23 of those 43 cases were not vaccinated individuals. And 10 of those were unknown, meaning we were unable to get any information of their vaccine status. And you might ask yourself why we can't get that. And that comes into question of when they're admitted to the hospital. Sometimes they are information is not gathered on their admission, and then they might be discharged or something like that. So that's one reason why we're unable to put that information on the dashboard really quickly. But that is something that we're trying to work on because that is what we'd like to also have to push out that information. Thanks.
All right, thank you, Marley. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Pivoting. Governor, there are IRS liens against some justice entities, including the Greenbrier Hotel Corporation. Can you respond to that? Can you provide any explanation? And how is the Greenbrier? Thank you.
Brad, I really, I'm super respectful, and I try to answer every question. I've told everyone, that if you'll tend to the business of the state of West Virginia as I'm tending to the business of the state, and you'll just stay out of my family's personal stuff, you'll find the outcomes. You'll find that the final outcomes will be exactly what I've told you they'll be. They'll be worked out. They'll work out, and in this situation where we're in this situation because primarily of a bank that turned around and went bankrupt. A bank that went bankrupt, and from all of that, they were a very, very bad actor of which we had no knowledge in any way that you could possibly have. And from all of that, and there's been other things that happen along the way that will get worked out just like, that they have done in the past. And from the standpoint of the Greenbrier and the folks at the Greenbrier, we've got nearly 2,000 employees there. Those folks are doing great, and the amount of the business that's going on there, I've been reported that it's doing well, and really and truly, there's no point in me elaborating whatsoever because from the standpoint of legality and everything else, it's just you can continue, to run down rat holes and try to come up with stuff and everything and here and there. But at the end of the day, I hope and pray at least, that you'll report the final outcomes. And when the final outcomes come out, I hope and pray you'll report that. We've managed to not report much at all about the fact that there was meetings with our people and the Credit Suisse people and everything. And the outcome of those meetings was extremely, extremely good. Basically, in the fact that from Bluestone's standpoint, the outcome was fantastic. And Bluestone continues to operate, and employees are down there doing great stuff, and we should have celebrated that. What we should have celebrated was to say the bad actor, the Green Seal, the bad bank that caused all this uproar and everything else, for Credit Suisse, for Bluestone, for the justice entities and everything else. Credits, they're just out of the picture, and they're fading away. And what we should have reported as hallelujah, Bluestone is continuing on, employees are continuing on, everybody's in great shape, everybody's happy, everybody's moving forward, but what we do is just continue to just dig around for something in the negative, and that's not what I think you should be doing.
All right, Governor, I'll turn it back to you.
If I could jump back to just this, you heard from General Hoyer today, a very passionate plea from General Hoyer. I think you should take heed. The other day, you saw the look on the face of Dr. Marsh in regard to the Delta variant. And Dr. Marsh was concerned, was he not? I really picked up on that, and I wanted to re-emphasize just this. Here you have two superheroes, and one of them is pleading with you again about the vaccines, and the other one's telling you this Delta variant is coming, and it's all across our country, and it's probably going to get bad here. Now, I would just ask you this, and I want you to really dial into this and everything else. How much fun has this summer been? How much has it been? How much fun's it been? How much fun has it been to watch a ball game on TV, an NBA final or whatever, and see the crowd going crazy? How much fun has that been? 4 months ago, We watched TV of reruns of games or contests or golf tournaments or whatever it was, and the crowd was massive. People absolutely lined up shoulder to shoulder, sitting in seats in arenas that were just massive crowds. And we looked at the TV in disbelief, didn't we? 4 months ago, 3 months ago, we looked at the TV and said, we'll never see that again. Really, it will never go back to that again. We hoped we would, but we said we'll never go back there again. Absolutely, that astounded us to look at a rerun of all those people piled on top of one another. And then, all of a sudden, the news started really changing. And it changed because we were getting vaccinated. And absolutely, we started to get a hold on this thing, didn't we? And we really started to pin it down. And then all of a sudden, the crowds came back. And the cheering and everything came back. The celebrations at the picnics and grandma's dinners and everything, they all came back. And now, we got a big decision to make, don't we? How much fun has the summer been? That's all there is to it. The summer can continue on. The summer can be a permanent continuation of exactly what we've enjoyed this summer. All we got to do is get vaccinated. If we don't, we could very well spin right back into bad, bad, bad times. I absolutely would tell you just this too. If we don't get vaccinated on this go-round, think about what's going to happen. Are we going to get in a situation to where, because of bad things that can happen, whether it be the CDC or whomever, are we going to get in a situation to where we get neighbor against neighbor, saying, you didn't get vaccinated and you're the cause of this? Are we going to get into that? Heavens to Betsy, this thing could be really, really, really bad for all of us. Some way, somehow, on day 501, can you imagine? Can you imagine we've been at this for 501 days and we still absolutely can't get to the finish line when we can see it right in front of us. We can see it right there. And we're going to get dragged right back into the same pit that we've been in over and over and over. We can see the finish line. You got to get there. You got to get there. The only other thing I have is just a little bit of an announcement, as far as all these drawings and stuff like that. The last drawing will be on August the 4th. And if you get vaccinated before 11:59 p.m. on August the 1st and you're registered into the system, at that time you'll be eligible for the drawing. But I don't know what else I can say and do. We're going to keep trying. That's all I know to do.